Guys and girls, this is Jerningham here. We're going to be talking about more of this virus, and we're going to be doing another video on it. So let's get into it.
Broadened that, there are parts of the country where the case rates, thankfully, as you saw in the charts, have been coming down.
This is part two.
And
Matt Hancock speaking,
the whole basis of the tiered
Secretary of
system
UK.
Is to take a proportionate approach to the areas where we need very firm action and other areas where we clearly need restrictions, but they don't have to be as drastic. Now, added to that, of course, is everybody's personal responsibility. And that is the critical thing this Christmas and through to the new year. It is really important that people make sure that they minimize the chances of them passing on the disease, because it's actually by all of our actions collectively that we get this under control. On the new variant and the South African variant, I'm going to pass to Susan Hopkins, if I may, who is the expert on the genomics, and then ask Jenny to comment on the epidemiology. Susan.
Right, thank you. So the new variant in the UK, which we've identified, is very different to the variant in South Africa. It's got different mutations. Both of them look like they're more transmissible. We have more evidence on the transmission for the UK variant because we've been studying that with great detail with academic partners. We're still learning about the South African variant, and you've heard already the measures that we're introducing to ensure that we quarantine people who are coming in from South Africa. And therefore, we are pretty confident, actually, that the system we have in place will help control the spread. Clearly, this needs to be continually monitored, and we have a genomic system in place to do that. And we are looking at to constantly enhance the detection of cases in travellers. I'll hand over to Jenny.
Thank you, Susan. So, yes, I think going back to the tiered system, obviously, as you could see from the slides, against the old version of COVID, our original one we were dealing with, those tiering systems in tier 3 has been very successful. The problem now is that we have very high rising rates of the new variant in the UK.
Can't believe it's from South Africa, the new variant.
Viruses to mutate, so I think this should not come as a surprise. What is obviously very clear is that the UK has a huge capacity to look at these different variants and advise at an early stage. So that's very positive. In terms of the tiering, effectively what it's doing, it's encouraging and tightening our own behaviours and helping us to keep those behaviours within the areas that we are living and working. And that actually is the most important thing. Although the virus in both these cases appears to be more transmissible, at the moment, on current evidence, the actual disease that one gets is no different. And so all of the basic measures which we are continually trying to do and which the tiers help us to do should actually prevent it. So normal things, wearing face coverings if we're with people, crowded places that we don't know, keeping our distance generally, keeping rooms ventilated, not going out when we don't need to, keeping all of our contacts down. So exactly the same interventions are the right ones, and they will work against all of the variants. What the tiers are doing are helping us with that behaviour and limiting us when perhaps we want to stray off course a little bit and we forget.
Thank you very much indeed. The next question is from Dan Hewitt at ITV. Dan.
Thank you, Secretary of State. Given the direction of travel here, isn't it now inevitable that the vast majority of the country, if not all of England, will end up in Tier 4 at some point in the next few weeks? If so, why wait for that time? Why not do that more decisively now? On the new strain of the virus, I know it's early, but is there any evidence at this stage to suggest that it wouldn't work? So the new vaccine wouldn't work against this new strain? And a very quick fact question. Could we have the latest number, please, the number of people who received their first dose of the Pfizer vaccination, please?
Thanks very much. So I'll answer the first and third and then pass over to Dr. Hopkins for the second question. The answer to the third is that we will be publishing tomorrow the full data on the vaccination programme so far, and we'll publish those as formal government statistics for the first time. And then we'll expand the statistics that are available around this programme on a weekly basis as we're going to publish those data weekly from now on. On the first question, absolutely we act fast, and you'll have seen from the action that we took and announced, the Prime Minister announced on Saturday, that we're prepared to act incredibly fast and take further action as we did this morning. We also want that action to be proportionate, and in the parts of the country where the number of the new variant is very low, of course we want to keep it that way, and the current tiers are working. What we've all got to do, as Dr. Harries has just set out, is we've all got to take responsibility for our own actions as well, and reduce the amount that anybody might be spreading it, because of this critical fact. 1 in 3 people who have coronavirus don't know they have it, but can still spread it. And if we all act like we might have it, then that is the best way to reduce the transmission. Susan.
So I would just reiterate that, treat everyone like they have it and we'll start to get to a better place. From the point of view of the vaccine, so we have no evidence at the moment that the vaccine will not work. So actually what that means, in fact, is that there's strong evidence that it will work, because the vaccine produces a strong immune response and it's broad and it acts against lots of variation in the virus. What we are doing is laboratory studies with people who have had previous infection and who've had vaccine, to look and see in the laboratory how their blood kills the virus. Those take a number of weeks as we grow the virus and do those studies. As soon as they're available, we will of course release them. We will also be monitoring the people who've had the vaccine very carefully, as we would anyway in coming weeks, to determine whether they have a less risk of infection, both of clinical infection, but also of subclinical infection, particularly in healthcare workers who are getting regular screening. So we will have both laboratory data and then clinical data in weeks ahead that will help us. At the moment, though, we have all the faith in the vaccines that we have. They produce a broad response, and I would recommend that everyone who is offered one takes a vaccine.
Thanks very much, Dan. Next question is from Rob Powell at Sky.
Hello, Health Secretary. How confident are you that Tier 4 restrictions is enough to bear down on this new variant? And if it's not, what other levers have you got to pull to try and bear down on the new variant? And to Dr. Harries as well, you've outlined some pretty stark increases in infections in recent days and weeks. Do you expect those percentage increases in infections to be mirrored in hospitalisations and ultimately deaths
That's my hand.
as we go further down the line? And if you do, what impact will that have on the NHS?
Well, Rob, in answer to your first question, it took us some time to work out the 3-tiered system, which was calibrated to keep the old variant, the original variants, under control. And we got to a point that the tiered system, the 3-tiered system, was effective against the old variants. In fact, there's an interesting study being published today in the Lancet that tests again the old variant against those 3 tiers. And the critical question is Tier 4 working against the new variant, just as you asked in your question. We have made sure that the Tier 4 measures do as much as is reasonably possible, but it all depends on how people actually behave. You know, this is a partnership. There's so much that we can do in terms of setting the rules and legislating from government, with all of the consequences that those actions have. But there's something that every single person can and should do, especially with the vaccine. Actually, I was about to say on the horizon. It's not on the horizon. It's here. It's being injected.
As you can see there, TB from South Africa has been
with just
the new virus.
Time to get the vaccine rolled out left, we should all be extremely careful about the social interactions that we have, because it is, yes, about the rules that we set in government, but it's actually about how every single person acts. And the good thing is that throughout this crisis, the vast majority of people have acted in a really responsible way. They've done their bit. And of course, it's easy to see, you know, pictures of people running for trains and what have you, but actually that has been a small minority. So let's all stick at it and not give in to temptation, and that way we'll be able to get through it and make sure that Tier 4 is indeed effective against the new variant. There was a further question embedded.
There was, I think, about case rate rises and how that translates to the NHS. So obviously you can see from the slides that sharp rise in cases is going to need some stopping. And as Secretary of State has said, this is not something that can be orchestrated. It is something which we all have to do. And however sad a time of year it is for us to be reminded that we need to behave that way, it is a very stark reminder that we do need to manage our own behaviours, keep our distances. I think, as I said earlier, there is no reason at the moment to suggest that the new variant will, if you like, turn into more severe disease or more deaths. But clearly, if we have more cases, then we will see rising numbers.
I kind of seen they don't know what they're talking about on this news channel.
But it's not inevitable that they will. If we do,
So if you guys and girls agree with me, but you know,
Christmas, limit the number of people that
they say it's not going to be as worse.
Those
I don't
numbers
believe
are
that.
not inevitable rises.
It's a new variant's going to be worse.
I think it's important to highlight. Obviously, care homes and the elderly are areas where we have seen very significant rates, sadly, of deaths before and serious cases. There are significant measures in place now, and Secretary of State has obviously highlighted this afternoon that testing is going in urgently in response to these rising case rates. So I think with all the hard work which the care home staff have been putting in, and the residents themselves, of course, in quite difficult circumstances, there are opportunities for us to ensure that these cases do not just automatically translate through into hospital cases.
Thanks, Rob.
They will.
Jane Merrick at the Eye. Hi, Jane.
Hi there, thank you. To the Health Secretary, first of all, he said that Tier 3 is not enough to contain the new variant and that it is spreading at a dangerous rate. And across the country, hospital patients is at the peak in spring. Nerve tags said this morning that the new variant has seeded across the country. We're now hearing of a second new variant from South Africa. So why aren't we going into a full lockdown across the whole country? And if I could ask the medics, Neil Ferguson of Nerve Tag said this morning that there is a statistically significant, albeit small, evidence of an increased proportion of infections among the under 15s. Is there a case for mass testing in primaries and perhaps a staggered return for primaries as well as secondaries?
Thanks very much, Jane. And so the answer to the first question is that the new variant is highly concentrated, and the stay-at-home rule in the east, the southeast, and London is aimed at keeping this new variant from spreading across the country, and that's why we've taken the approach that we have in terms of the tiering and expanding the number of areas that are in Tier 4. On the education question, I'm going to ask Susan to answer on the virology, and then Jenny to answer on the question of the consequences, especially for schools.
So firstly, we have no evidence that this virus is more transmissible in children yet. But what we do know is that when this virus took off, the children were one of the few things that were happening at the end of the national restrictions that was still happening and mixing. So it was more likely that the transmission could start in that place. And I think we have seen that especially younger age teenagers have seen a higher number of infections. There's much less infection in primary school children, and we've seen that throughout the pandemic to date. And we will constantly take decisions with the experts in education over what is best for the children along with controlling the virus. And I'll hand over to Jenny to add some more.
Yeah, just to add to that, I think, as Susan has said, if we look at historically, if we're going back a few months now, what happened when we had very significant rates of the original variant COVID virus in the north, we did see rises in cases in children there, but they were very much lower than they were in the adult population. They did rise quite steeply in teenagers. And I think we do know that there is transmission, but as Susan has said, it is generally lower as you go down the age groups, and it is extremely difficult to untangle what the children are doing. So there is perhaps an assumption that if children are at home, they won't transmit disease, but we have to be really clear that that is the case. Schools are very controlled environments in many cases. And so we know what children are doing there. And it's very difficult to disentangle, for example, what a child is doing in school, what a child is doing at the school gates, or on the way to school, or in their community. So I think education is really important for children, and we shouldn't jump to the conclusion that just because every child is in school, that is a significant place for transmission. And as Susan has said, there is a lot of work on
I don't know, mate. You'd have to.
continuous studies to try and understand this in a little bit more detail.
Yeah. Oh.
Thank you, Jane. Merry Christmas. Next question is from Sam Lister at The Express.
Thank you, Secretary of State. With the Oxford vaccine on the brink of being approved and 100 million doses on order, how soon do you think you'll be able to stand before us and say that the vast majority of the British public have been vaccinated and this virus is beaten? And how many people do you expect to be vaccinated before Easter?
Oh, Sam, you're so tempting. I really want to have a stab at the answer, but the truth is we just don't know. It depends on the speed of manufacture. I'm really thrilled that the full data has been passed to the regulator, and I have every confidence that the regulator will look at it with great capability. I want to put no pressure on them in terms of the decision or the timing of the decision. It is absolutely a matter for them. But then we've always said that the vast majority of the vaccinations will be in the new year, and I think that our vaccination program started before most people expected it to. We've made really good strides over the month of December so far, and we will go as fast as we possibly can. This will be a big task for the NHS. What I would say in terms of the number of people vaccinated is that I think we will get there by the spring, and that people should therefore just hold on and really try to resist temptation to do things that they shouldn't and to see people that they don't need to. And I know that is tough, and it's going to be a tough winter, but the more people do that, the more quickly we're going to get through this together. I wish I could give you a more direct answer than that, but we just aren't there yet. The true answer will be as fast as we possibly can. The final question from Arj Singh at the HuffPost.
Hello. People are pinning their hopes on the vaccine allowing a return to normality in a few months. But Professor Stephen Evans of the London School of Hygiene and Tropical Medicine suggested this week that the UK wouldn't be able to go back to normal until half the population had been vaccinated. And there are some suggestions that might not happen until 2022, unless rates of the virus are very low. Given the emergence of a highly transmissible new variant, has the government overpromised yet again in suggesting that Easter could mark a return to normality?
No, I'm highly confident that we'll get things back to normal before 2022, based on the speed at which we can roll out the vaccine.
Yep.
Not least because it's really important that the speed of rollout of the vaccine is accelerating. All the time we're adding more places to where the vaccine is being deployed from, and so we're accelerating the pace of the rollout. If you take the current pace and take that as a given, then without an acceleration, you would get to the wrong calculation for the speed at which this vaccine is going to be rolled out. But each venue that we open for vaccinations has to be approved, has to be got right. Very, very important, because you've got to make sure that the vaccine gets into people's arms in a safe way so that we know that they're safe, but also that the vaccine works. That's why we're not putting projections on these figures. And precisely as you say, to make sure that we only commit to that which we know we can deliver. I don't know if anything to add, Susan.
No, I agree. The sooner we vaccinate people, the better. But it will take some time.
That's right. Thank you very much indeed. Thanks everyone. That ends this coronavirus briefing. And the final thing to say is I wish you all a happy Christmas.
Wow.
Well, a pretty sombre news conference there from the Health Secretary, Matt Hancock, who announced that another new variant of COVID-19 has been identified in the UK. 2 cases of this new variant, both of which have been close contacts of those in South Africa. And this new strain of the virus is, in the words of the Health Secretary, highly concerning, even more transmissible. 2 contacts of cases that have travelled from South Africa. Anyone who has travelled from South Africa in the last 2 weeks, or is a close contact of anyone who's travelled from South Africa in the last 2 weeks, is now being asked to self-isolate. He also announced more areas of the country moving into the highest level of restrictions, Tier 4. They are Sussex, Oxfordshire, Suffolk, Norfolk, Cambridgeshire, Essex, Waverley in Surrey and Hampshire, apart from the New Forest. Moving up to Tier 3, Bristol, Gloucestershire, Somerset, Swindon, the Isle of Wight, the New Forest, Northamptonshire, Cheshire and Warrington. And moving up to Tier 2, Cornwall and Herefordshire. So no part of the country remains in Tier 1 now. On the good news front, he said that Oxford AstraZeneca has submitted a full data package to the MHRA for approval. Vaccination has begun in care homes, starting with the Chelsea pensioners. But very, very concerning news about this new variant, another new variant identified from South Africa, and suggestions from the South African Health Minister that this new variant more severely affects young people than the previous virus has done. Let's bring in our political correspondent, Rob Powell, who is listening in Westminster. It isn't good news, Rob.
No, I think Matt Hancock trying to bring a bit of festive optimism to that news conference, but it really was sombre on several fronts. In terms of that new strain, that new variant, another new variant where 2 cases have been identified originally from South Africa. The Health Secretary saying that restrictions were now being brought in on travel from South Africa, that quarantine regulations would be brought into law to make sure that anyone who either has that variant or is a close contact of someone that does, or a close contact of someone that's come back from South Africa, is placed into quarantine. The UK, I guess, finding itself on the other end of responding to another international variant that we've seen the responses from other countries towards the UK around the first variant, now struggling to try and make sure that this new variant stays under control. Now, in those questions to Susan Hopkins from Public Health England, she was asked whether there was any indication that the vaccines that are being approved would be ineffective against this. She said that the evidence as it stands at the moment is that they would expect the vaccine to work against this South African variant as well. But I think incredibly worrying that this may be even more transmissible than the first variant that started in the southeast of England. And I think the reason for that was outlined in some of the data that Jenny Harries, the Deputy Chief Medical Officer, laid out, that really shows that if it wasn't for this new variant, then actually cases would starting to be decreasing and the whole country would be in a lot more stable position. She showed some graphs that compared the trajectory of the original variant, if you like, to the trajectory of the new variant, and it really showed that the massive increases in infections we've been seeing recently are being powered by this new variant. Matt Hancock saying as well that the 3-tiered system that we've been living with now was designed around the original variant, the original type of virus, and that actually those 3 tiers were not enough to contain this new variant. I think what might worry people more, though, is that when I asked the Health Secretary how confident he was that Tier 4 would bear down on this virus, he said that it will do as much as reasonably possible. So hardly a ringing endorsement, but many people finding that on Boxing Day they will be waking up under a very different set of rules.
Rob Powell in Westminster for now. Thank you. This is Sky News, and coming up in the next hour, another new variant. The Health Secretary says 2 cases of a new, more transmissible variant of COVID-19 have been detected in the United Kingdom.
Cool, blimey. What could one say about these new variants? Ears popped.
cases who have travelled from South Africa over the past few weeks.
Vital that we act. Large swathes of the east, southeast and southwest are placed under Tier 4 restrictions as cases continue to soar. Vaccine hopes. AstraZeneca submits its data for the Oxford jab for approval. Edging towards a deal. Downing Street says a post-Brexit trade agreement could be just hours away. And tensions spill over in Dover as lorry drivers begin to get tested for COVID. Good afternoon. In the last hour, the UK has confirmed 2 cases of a second, more transmissible variant of COVID-19. The new variant, linked to South Africa, led the Health Secretary Matt Hancock to place immediate restrictions on travel from the country. Mr. Hancock also confirmed that yet more of England will be placed into Tier 4, with cases continuing to soar nationwide.
As part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. The Chief Scientific Advisor and the Chief Medical Officer and others met their South African counterparts over the last day, and we are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible and it appears to have mutated further than the new variant that's been discovered in the UK. We've taken the following action. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight, must quarantine immediately. By quarantine, I mean they must restrict all contact with any other person whatsoever. We'll be changing the law to give this legal effect imminently. Now, these measures are temporary while we investigate further this new strain, which is shortly to be analysed at Porton Down. And I want to thank everyone involved for the seriousness with which I know that they will take these new instructions. We know that the 3-tiered system worked to control the old variant and is working now in large parts of the country, especially in northern England. But we also know that Tier 3 is not enough to control the new variant. This is not a hypothesis, it is a fact, and we've seen it on the ground. We've seen case rates rise in some of the places close to where the current Tier 4 restrictions are, in places like East Anglia, where we've seen a significant number of the new variant, and we've seen case rates rise sharply. It is therefore necessary to put more of the east and southeast of England into Tier 4. We're also taking action in parts of the southwest, where there are some early signs of the new variant and where cases are rising. Even though case rates in some of these areas are not as high as they are in the areas badly affected, in London, for instance, and in Kent, the direction is clear and in many cases quite stark. The doubling times are short. And we have learned that when it comes to being a matter of when, not if, we take action, it is better to act sooner. So from 1 minute past midnight on Boxing Day, Sussex, Oxfordshire, Suffolk, Norfolk and Cambridgeshire, those parts of Essex not yet in Tier 4, Waverley and Surrey, and Hampshire, including Portsmouth and Southampton, but with the exception of the New Forest, will all be escalated to Tier 4. Bristol, Gloucestershire, Somerset, including the North Somerset Council area, Swindon, the Isle of Wight, the New Forest, and Northamptonshire, as well as Cheshire and Warrington, will all be escalated to tier 3. And I'm afraid that Cornwall and Herefordshire have seen sharply rising rates and need to be escalated to tier 2. This is not news that anybody wants to deliver, and I am truly sorry for the disruption that it causes. But I think people know how important it is that we take decisions.
I'm going to see how long it's been on for now. It's halfway through the video, I think, in here.
And this afternoon, the R number range for the UK was revised. It is now between 1.1 to 1.3. That is up from 1.1 to 1.2 last week. Our science correspondent, Thomas Moore, joins me now. So news of another new variant which is highly transmissible, more transmissible than the previous variant, Thomas. What can you tell us about it?
Well, we know that this variant emerged in South Africa. It shares some of the mutations of the other variant that we're just getting to grips with here in the UK. They overlap, but these viruses did evolve separately. So this seems to have come from South Africa, and it has, they think, been driving the surge of infections in that country. That it has a higher transmissibility rate, so it spreads more easily from person to person, but it seems to be affecting younger people to a higher degree, and that will cause a concern, because of course we are directing the vaccine at the old, because they are thought to be more vulnerable in this country. So if this does take off, and it's a big if at the moment with the restrictions that Matt Hancock unveiled there, clearly trying to shut it down. But if it does take off, then it will be a significant concern. I think what is now being attempted by the government is to shut this down before it even gets a grip in the country. That if there are just a handful of cases, that those should be able to be contained or certainly slowed while this vaccine is being rolled out. And that is the big question here. How quickly can the vaccine be rolled out to protect those most vulnerable when you have got this virus, which it's really playing cat and mouse with the scientists now, and it is evolving, clearly evolving, and that is going to potentially cause problems. Maybe not with the vaccines yet, but potentially, if it continues to mutate, that will be something we have to get to grips with in the coming weeks and months, and perhaps redevelop booster doses for people in the coming years.
Okay, Thomas, thank you. Large swathes of the east, southeast and southwest of England are to be placed into tier 4, the highest level of COVID restrictions from midnight on Boxing Day morning. Live to Westminster and our political correspondent, Rob Powell. And this in reaction to a surge in cases in those areas, Rob.
Yeah, the concentration of tier movements being in the southeast, around London and the southeast, the existing tier 4 areas. So the list being Sussex, Oxfordshire, Norfolk, Suffolk, Cambridgeshire, the rest of Essex, Waverley and Surrey and Hampshire, including Portsmouth and Southampton, but not including the New Forest. They're all moving into tier 4. That takes effect from Boxing Day. So in those areas, the Christmas bubble rules of mixing just on Christmas Day will remain according to the tier they are in at the moment. Also moves as well into tier 3 and tier 2. Into tier 3, we see Bristol going. Now, Bristol just days ago moved from tier 3 into tier 2, has been there for a matter of days, and now is going back to tier 3. Gloucestershire, Somerset, including North Somerset, Swindon, the Isle of Wight, New Forest, Northamptonshire, Cheshire, and Warrington as well, all into tier 3. So that's the Isle of Wight going from tier 1 to tier 3. And then into tier 2 is Cornwall and Herefordshire. Herefordshire was placed into tier 1 a matter of days ago, so it spent days in tier 1 with things like pubs and restaurants able to fully open for a matter of days before they're having to go back to doing meal service if they want to open. All of this coming in from Boxing Day, which I guess begs the question that if the situation's grave enough in some of the areas going into tier 4 for it to go into this top category, is it really wise for people to be mixing on Christmas Day? On that, Matt Hancock really just trying to bolster up the tone and the language, saying to have as fewer contacts as possible. Now, of course, the reason why this is all happening, as laid out in some of the data that we saw in that press conference, is because of the very big impact that this new variant, and I say that's the original new variant as opposed to the South African variant, the impact that is having on infection rates. And very stark numbers from Matt Hancock saying that infections have gone up 57% in a week. and that the three tiers that they'd initially constructed aren't enough to control this new variant. And that is why we are seeing places rise up through this tiering structure. But I think it begs the question, if the three tiers aren't enough to control this new variant, how long before the whole country ends up in the top tier?
Rob, thank you. I have more grim news to bring you now, and that is the government data on coronavirus in the UK that has just been published. 39,237 cases were recorded on Wednesday today in the last 24 hours. That's up from 36,804 the previous day in terms of the number of people who have died. Within 28 days of a positive coronavirus test, that figure also sharply rising, 744 deaths recorded in the last 24 hours, up from 691 the day before. Let's speak to Dr. Kit Yates, Senior Lecturer in Mathematical Biology at the University of Bath. Dr. Yates, thanks for being with us. The bad news just keeps on coming, doesn't it? And just as we're starting to get our heads around one new variant, we are told about another one. How concerning is this news about the South Africa variant?
Yeah, of course it's worrying. Typically there are three things that we think about when a new strain emerges. Does it transmit more easily?
Oxford, Tier 2.
Does it cause worse health outcomes, higher hospitalisations, higher fatality rates? And could it evade the current vaccines that we've got? The evidence at the moment suggests that certainly this the new variant, the B117 that we have in the UK, is more transmissible, maybe around 70% more transmissible. This new South African strain also sounds like it may be even more transmissible than that, but the consensus is yet to be arrived at. But in terms of the other 2 points, does it cause worse health outcomes? There's no suggestion at the moment that that's the case, and there's also no suggestion that it's capable of evading the vaccines we got. So there is some positive news to take from this.
Yeah, I was just reading remarks from the South African health minister, who was issuing a warning to young people that this does seem to be affecting younger people to a higher degree than the original virus. Others suggesting it's too early to know, but that would be a concern, and that would also potentially impact government policy when it comes to schools and universities returning in the new year.
Of course, it would mean we'd have to think really hard about how and when schools go back and the measures that we are going to take to try to make schools safer. Of course, the government are talking about doing mass testing to try to make sure that we isolate people who are positive, but there are lots more things we can be doing with schools in terms of ventilation, potentially providing winter fuel budgets to mean that schools can have their windows open and still keep their children warm. Things like potentially asking children to wear masks in the classroom as well as just in corridors, and trying to expand the space that we've got in schools so that we can have students as socially distant from each other as is possible to try to reduce the spread in schools, especially if this new South African variant is more dangerous to children.
Given what we are hearing, given the number of cases we are now seeing each day, are the restrictions that are being put in place, more coming in on Boxing Day, are they going to be enough to try and keep control of this?
It's really difficult to know. Like you said, there are 37,000 cases yesterday, 39 today, which are both record numbers for reported cases. Again, for this second wave, we've had record numbers of deaths reported over the last couple of days. The situation is pretty bleak. We don't know enough about whether Tier 4 is going to be enough to control cases. We just haven't had enough time to assess that. But I thought it was interesting to hear Matt Hancock say that he thought that there was no need to put some areas with lower case rates into Tier 4 yet, because the tiers were enough. The tier that they had at the moment was enough to keep control of the spread, in the same breath as saying that actually Tier 3 was not enough to control the spread of this new variant. It suggests that actually, the regions which have low case numbers of the new variant at the moment, they will continue to rise, and actually action needs to be taken there. And one thing that we've learned from this pandemic and our response to it is that fast and decisive action is always paying dividends. And so if the virus is spreading as fast as it is, it makes sense for us to take action as soon as possible and as strongly as possible in all these areas. Now is the time for the government to be brave and to make unpopular decisions and to lead. In short, now is the time to act, because for many it's going to be too late if we wait.
Okay, Dr. Kit Yates, thank you very much indeed for your reaction to the breaking news in the last hour. Let's just remind you of those figures that have just been published. 744 COVID deaths in the UK in the last 24 hours. That is the highest number since April the 29th. 39,237 new cases recorded in the UK in the last 24 hours. That is the highest number on record. Well, let's move on now to talk about Brexit and discussions underway, continuing. There are reports that the EU and the UK are edging towards a post-Brexit trade deal, possibly within hours. An official in Brussels has been quoted as saying an agreement's been done, but Downing Street sources insist talks are still ongoing. The transition period ends on the 31st of December. Sky's Michelle Clifford is in Brussels for us. Have they or haven't they done a deal? Can you give us any indication, Michelle?
It sounds very much like they are going to do a deal. An EU official telling me this evening that we are in the end phase of a deal. Hasn't been done yet. They're still negotiating. They've been pushing it right up until the very end, but it really is now sounding very, very promising. And I think a big factor this week is that we know that the President of the European Commission, Ursula von der Leyen, and Boris Johnson have been in regular contact, talking over the phone on the thorny issues that are still outstanding. We know that fishing has been taxing the two sides of the channel right up until the very end. But we think that they are getting there. Some sources have indicated that a deal could be announced in the next few hours. But remember, it needs to be signed off by the EU 27 leaders. It needs to be ratified by the European Parliament. That will take some time. So what we're expecting is, if there is a deal announced, then there'll be what's called a provisional application of the deal, and then MEPs will get to ratify it in the new year. Of course, as you mentioned, the transition period ends on the 31st of December. But of course, the devil will be in the detail. We understand now the legal documents enveloping this whole agreement run to something like 2,000 pages, and they will need to be scrutinised. Everybody will be looking to see, what did the EU give on fishing? What did the UK give on the level playing field? That kind of thing. But after 9 months of torturous negotiation, when very often on both sides people indicated, or sources indicated, that a deal...
Well, that was a short video. I mean, they were talking about a deal about the EU, and then it decided to go off. I don't know why it did that, but it has its reasons why. But anyway, that was a short video, but hope you all enjoyed it. Give it a like, give it a comment, share it with your friends, and see you in the next video. Peace.